Let's talk about the Federal Employee Health Benefits Program. This is your FEHB. You've carried it as a federal worker, and now you're getting ready to go into retirement. There is a 5-year rule that states that you must be enrolled in FEHB for the 5 years prior to retirement in order to carry this coverage into retirement. Now, if you are military or you have time that you spent under TRICARE, then this will satisfy the 5-year rule, allowing you to carry FEHB into retirement as well. Now, if you have this TRICARE, you may also suspend the FEHB coverage, and we recommend that you suspend your FEHB because if you are to cancel your FEHB, then you will lose it. It is to never be regained in retirement, but suspending it allows you to use TRICARE as your primary and reach out for your FEHB when you need it. Now I would like to talk with you about spousal continuance. If you, the federal employee, are married to an individual who is not a federal employee and they will be dependent on your health insurance in retirement, you are required to leave them some type of survivor benefit in order for them to carry the FEHB coverage into retirement. Also, you must be enrolled in a family plan as well. So please keep that in mind, that your health insurance and the survivor benefits are linked together with one another. So if your spouse needs your insurance in retirement, be sure to leave them a spousal benefit and also have the family plan. Next, you will find a premium conversion in retirement. Currently, you are paying for your health insurance premiums with before-tax dollars. In retirement, you will pay for these premiums with after-tax dollars. So the government will continue to pay their 72% while you pay your 28%. There will just be a tax implication that will be added. I have an example here on the screen for you. An FEHB premium while they're working was $462 a month. This is based on a family plan. And in retirement, have a 30% tax rate, and this increases their premium from $462 a month to $600 a month. Next, I would like for us to talk about couples where both spouses are federally employed. Here at RBI, we refer to you as dual-fed couples. I want to point out to you that as long as you both are employed and enrolled in FEHB, whether it be together or separately, then you are eligible to carry this FEHB into retirement. One planning tip that I would like to recommend for you is if you and your spouse are planning to retire on separate retire dates, meaning you're not retiring within the same year, one thing that you can consider is that the working spouse, the one who is working longer, could carry the health insurance and pay for those premiums with before-tax dollars, whereas those who are in retirement will have to pay with them with after-tax dollars. So that's a quick planning tip for those dual-fed couples and just something for you to consider. Also, special needs children, as long as they are a survivor annuitant, then they are eligible to keep their FEHB coverage. And then, of course, the Self+1 has been added to the FEHB program this year, and open enrollment is upon us. We are excited about this new coverage and the benefits that it could provide. Here at RBI, we recommend that you do a cost comparison. Because this is new, it's hard for us to make a recommendation at this point, but I would like to urge you to reach out to OPM and the websites that carry those costs and compare those and see what benefits your family the most. Of course, open season is this November, and the plans will become effective beginning January. In this Self+1 coverage, it covers the federal employee and one eligible family member. So if you may not need the full family coverage, and so this may be more cost effective for you. Let's talk a little bit about Medicare. First of all, I would like for us to cover each part individually. We'll start with Medicare Part A. This is your hospital insurance, any of your skilled nursing facilities and hospice, home health care. This is what is covered under Part A. There is no premium as long as you have paid into the Medicare taxes while you're working, and FERS and CSRS employees, that considers you. But if you did not pay into Medicare while you're working, then you can buy Part A if you meet certain conditions. But this is your hospital coverage, and it is an automatic benefit as long as you paid in. Next, let's talk about Medicare Part B. This is your doctor's offices, your doctor office visits, outpatient care, home health services, and some preventive services. There is a 7-month enrolling period for this coverage. Now, it all revolves around your 65th birthday if you are retired. The enrolling period is the 3 months prior to your 65th birthday, the month of your 65th birthday, and the 3 months following your 65th birthday. So there is your 7-month window all around your 65th birthday when you're eligible to apply. Now, if you plan to retire after age 65, then you can enroll. There's an 8-month enrolling period for you after age 65. The open season is every year, January through March. There is a late enrollment penalty of 10% of the current Part B premium for each of the 12-month periods that you could have had Part B coverage, but you didn't take it. So know that that penalty will apply if you decide to enroll after the open season period. Next, let's talk about Medicare Part C. This is your Medicare Advantage plans, which are offered by private insurance companies who have been approved by Medicare. This coverage provides all of your Part A and Part B coverage and may include extra coverage such as vision, hearing, dental, and or some health and wellness programs. Some Advantage plans do include the Medicare Part D, which is your prescription drug coverage. This will all be covered under one premium. The different Advantage plans can charge different out-of-pocket costs at different times. So next, let's look at Medicare Part D. Now, as I just mentioned, this is your prescription drug coverage, and this too is also run by an insurance company or other private company that has also been approved by Medicare. There are 2 ways that you can obtain this Medicare prescription drug coverage. The first, of course, I mentioned earlier, was the Medicare Advantage plan, and the second is your Medicare prescription drug plans. Some Medicare cost plans will be included in that as well. Now that we've talked about your FEHB coverage, we've talked about your Medicare coverage, and we often have individuals come to us and say, what do I do? While I'm not here to tell you what to do, I would like to show you 3 options that you have available in commingling your FEHB and Medicare. So looking at the screen here, at age 65, your first option, you can not enroll in Medicare Part B and keep your FEHB in place as your primary coverage. And option 2, you can enroll in Medicare and suspend your FEHB. Remember earlier I suggested that you never cancel your FEHB, but suspend it. That way if you ever need that coverage, you have access to it. Or you can look at option 3. In option 3, you would enroll in Medicare Part B and keep your FEHB. This would allow Medicare Part B to be your primary and your FEHB to be your secondary. Keep in mind that option 3 comes with 2 premiums that you will have to pay as well. But these are your 3 options that you have whenever you are weighing the options of FEHB and Medicare coverage. There are some doctors out there at this time who are not taking Medicare patients. So if you have a doctor that knows your medical history, you're more comfortable with them, you may need to reach out to them and talk with them. Do you plan to take Medicare patients? If your doctor's list is not as important to you, then Medicare may be more flexible for you. So you have some options here. Be a wise consumer in this planning aspect and study a little bit to find out more about what is best for your situation.